If you're over 65, there's a good chance your doctor has recommended a medical test recently. Maybe a scan, maybe a screening, maybe a routine check that sounded perfectly harmless. And you probably said yes. Of course you did. Because we've been taught our entire lives that more testing means better health. That catching something early is always better than catching it late. That saying yes to every test your doctor offers is the responsible thing to do. But what if I told you that some of those tests that millions of seniors undergo every year, might actually be making your health worse, not better? I'm not talking about quackery. I'm not talking about ignoring your doctor. I'm talking about something the medical community has been quietly debating for years, but rarely discusses openly with patients, something called the cascade effect. It's the hidden chain reaction that starts with one innocent test and ends with unnecessary anxiety, invasive procedures, surgical complications, and sometimes genuine, lasting harm to your body. Today, I'm going to walk you through 4 specific medical tests that seniors over 65 should seriously question. Tests that are widely prescribed, widely accepted, and in many cases, doing far more damage than good. I need you to watch this entire video because what I share here could protect you from months of needless worry, thousands in medical bills, and procedures your body never needed in the first place. Before I tell you which tests to question, I need to explain why, because this only makes sense once you understand the cascade effect. Here's how it works. You go to your doctor for a routine visit. Everything feels fine. You're not in pain. You're not sick. But your doctor says something like, at your age, it might be a good idea to run a scan, just to be safe. Sounds reasonable, right? So you say yes. The scan is done, and then the radiologist finds something, a small spot, a shadow, a nodule, something that looks slightly unusual. Now, here's what nobody tells you beforehand. In people over 65, these findings are incredibly common. Your body has been alive for 6, 7, 8 decades. It has scars, cysts, benign growths, healed injuries, and harmless abnormalities that have been there for years, maybe decades, causing absolutely no problems. But once they show up on a scan, they can't be ignored. The doctor has a legal and ethical obligation to investigate further. So now you need another test. Maybe a more detailed scan with contrast dye, maybe a biopsy, maybe a referral to a specialist. Each step sounds reasonable on its own. Each step feels like the responsible thing to do. But each step also carries its own risks. Radiation exposure, allergic reactions to contrast dye, infection from biopsies, bleeding complications, anesthesia risks for older bodies. And here's the cruel irony. After all of that testing, after all of that anxiety, after all of those procedures, the final result very often comes back as, it was nothing, you're fine. But are you fine? You've just spent weeks or months in a state of fear. You've undergone invasive procedures that carried real physical risks. You may have suffered complications from those procedures. Your sleep has been disrupted. Your mental health has taken a hit. Your body has been stressed in ways that genuinely accelerate aging. That's the cascade effect. One harmless-sounding test triggers a chain reaction of increasingly invasive interventions, and the original finding was never a threat in the first place. A study published in the Journal of the American Medical Association found that up to 30% of medical procedures performed on older adults may be unnecessary, driven not by symptoms, but by incidental findings from routine screening. Let me say that differently. Nearly 1 in 3 procedures some seniors endure may have been avoidable. This doesn't mean all testing is bad. Far from it. If you have symptoms, pain, unexplained weight loss, bleeding, persistent changes, absolutely get tested. Diagnostic testing based on symptoms saves lives every single day. What I'm talking about is screening without symptoms, the just-in-case tests, the let's take a look tests, the ones that feel responsible but often trigger a cascade that causes more harm than the thing they were looking for. Let me walk you through 4 of the most common ones. Test number 1, whole body CT scans. The first test seniors should seriously question is the whole body CT scan, sometimes marketed as a preventive health scan or executive wellness screening. These have become incredibly popular. You've probably seen advertisements for them. Walk-in clinics offer them. Some wellness centers promote them as the ultimate peace of mind checkup. Get a full scan of your entire body. Catch anything hiding before it becomes a problem. It sounds brilliant. It sounds like exactly the kind of proactive healthcare we should all want. But here's what the marketing doesn't tell you. When you scan an entire body, every organ, every structure, every tissue, in a person who has been alive for 65 or 70 or 80 years, you will almost always find something. Not because that person is sick, but because human bodies accumulate benign abnormalities over a lifetime. Small cysts on your kidneys that have been there for 20 years, doing absolutely nothing. Tiny nodules on your thyroid that will never grow. A small spot on your liver that's been stable since your 40s. A slightly enlarged lymph node from an infection you fought off a decade ago. These findings are called incidentalomas, incidental discoveries that weren't causing any symptoms and very likely never would. But once they appear on a scan, they have to be investigated. Your doctor cannot look at a spot on your liver and say, that's probably nothing. They have to prove it's nothing. And proving it often requires a biopsy. A liver biopsy in a 70-year-old is not a trivial procedure. It carries risks of bleeding, infection, and pain. And if the biopsy comes back inconclusive, which happens more often than you'd think, you might need another one, all for something that was never going to harm you. And there's another risk with whole-body CT scans that most people never consider: radiation. A single whole-body CT delivers a significant dose of radiation, far more than a standard X-ray. For a younger person, the body can repair this radiation damage relatively easily. But as we age, our DNA repair mechanisms become less efficient. Repeated radiation exposure in seniors has been linked to a small but measurable increased cancer risk. So let me state that plainly. A test that's supposed to look for cancer could, through its own radiation, slightly increase your risk of developing cancer, particularly if you're getting scanned repeatedly year after year. The American College of Radiology and multiple medical bodies have explicitly recommended against whole-body CT scans for asymptomatic individuals. Not quietly, explicitly. If you have no symptoms and your doctor hasn't identified a specific concern, there is very little evidence that a whole-body scan will improve your health outcomes, and substantial evidence that it may trigger a harmful cascade. Test number 2, brain MRI for minor memory concerns. The second test I want you to think carefully about is a brain MRI for minor memory issues. This is a sensitive topic, and I want to handle it honestly. Memory concerns after 65 are deeply frightening. When you forget a word, misplace your keys, or blank on someone's name, the fear that immediately rises is this dementia? Is this Alzheimer's? Is this the beginning of the end? That fear is real and it is valid. I am not here to dismiss it. But here's what I am here to tell you. Occasional forgetfulness after 65 is overwhelmingly normal. It's called age-related cognitive change, and it happens to virtually everyone. Your brain at 70 processes information slightly differently than it did at 40. That is not disease. That is biology. The problem arises when that very normal forgetfulness drives someone, either the patient or an anxious family member, to request a brain MRI. And the doctor, wanting to be thorough, agrees. Now, what happens when you put a 70-year-old brain inside an MRI machine? You find things, almost every time. Small areas of white matter changes, sometimes called white matter hyperintensities. These show up as bright spots on the scan, and they look alarming. But in people over 65, they are extraordinarily common. Studies have found that up to 95% of adults over 60 have some degree of white matter changes on MRI. 95%. They're associated with normal aging, minor blood pressure fluctuations over the years, and are usually completely benign. But the patient doesn't know that when they see the report. They see words like lesions, white matter disease, cerebral changes, and they panic. Understandably so. Those words sound terrifying. And then the cascade begins. A referral to a neurologist, more specialized tests, perhaps a PET scan, perhaps a lumbar puncture to check for Alzheimer's biomarkers. Weeks of waiting for results, weeks of believing the worst. Meanwhile, the psychological damage is already done. Research has shown that the anxiety caused by an ambiguous brain scan can actually worsen cognitive performance. You read that correctly. The stress of thinking something is wrong with your brain can make your memory function worse. It's a cruel feedback loop. You get scanned because you're worried about memory. The scan finds normal age-related changes. The worry gets worse. Your memory gets worse because of the worry. And now you're even more convinced something is wrong. I have seen this pattern destroy people's quality of life for months, sometimes years. Now, let me be very clear about when a brain MRI is appropriate. If you're experiencing rapid cognitive decline, not occasional forgetfulness, but a noticeable progressive deterioration over weeks or months. If you're getting lost in familiar places. If you can no longer follow conversations or manage tasks you've done your whole life. If a loved one is telling you that something has significantly changed. In those cases, absolutely. Get imaging. Get a full workup. That is diagnostic testing based on real symptoms, and it can be genuinely life-saving. But if you forgot where you put your glasses this morning, if you blanked on your neighbor's name for a moment, that is not an MRI situation. That is a Tuesday after 65. Talk to your doctor about whether cognitive screening questionnaires, simple, non-invasive, in-office assessments, might be a better first step than jumping straight to imaging. They can identify genuine red flags without triggering the cascade. Test number 3, routine cardiac stress tests. The third test I want to discuss is the routine cardiac stress test in people with no heart symptoms. This is one of the most widely ordered tests for seniors and one of the most debated in modern cardiology. Here's how it typically happens. You go for your annual checkup. Your doctor listens to your heart. It sounds fine. Your blood pressure is reasonable. You have no chest pain, no shortness of breath, no palpitations. But your doctor says, at your age, maybe we should do a stress test, just to make sure your heart is doing okay. Again, it sounds completely reasonable. Your heart is the most important organ in your body. Why wouldn't you want to check on it? But here's the problem. Cardiac stress tests in low-risk asymptomatic patients have a troublingly high rate of what's called a false positive result. That means the test says something looks abnormal when nothing actually is. Why does this happen? Because the stress test is designed to detect significant coronary artery blockages, and it does that reasonably well in people who already have symptoms. But in people without symptoms, the test is far less reliable. In fact, studies have shown that in asymptomatic older adults, a stress test can produce a false positive result in as many as 1 in every 5 to 10 patients. And what happens when your stress test comes back with an abnormality? The cascade begins immediately. Your doctor now has to investigate. You'll likely be referred for a cardiac catheterization, also known as an angiogram. This is an invasive procedure where a catheter is threaded through your blood vessels, typically from your groin or wrist, all the way to your heart. Cardiac catheterization is generally safe, but in seniors, the risks are real and not trivial. There's a risk of bleeding at the catheter site, a risk of damage to blood vessels, a risk of blood clots, a risk of kidney damage from the contrast dye, particularly if you already have any degree of reduced kidney function, which is very common after 65. In rare cases, there's a risk of heart attack or stroke during the procedure itself. And after all of that, in a significant number of cases, the angiogram reveals that your arteries are perfectly fine, or that you have mild, stable plaque that requires no intervention. The original stress test was a false alarm, but you've just undergone an invasive cardiac procedure. You've spent days in anxiety. You may have complications from the catheterization that take weeks to resolve. Your kidneys may have taken a hit from the contrast dye, and your mental health has been through the ringer. Now again, if you have symptoms, the calculation completely changes. Chest pain during exertion, unexplained shortness of breath, palpitations, fainting episodes. In those cases, a stress test is an invaluable diagnostic tool. It can identify real problems that need real treatment, but as a routine screening tool in someone who feels fine, the evidence increasingly says the risks outweigh the benefits. The American College of Cardiology itself, not some alternative health group, the actual College of Cardiology, includes routine stress testing of asymptomatic patients on its list of tests that should be questioned under the Choosing Wisely initiative. Before you agree to a stress test, ask your doctor one simple question, Am I getting this because I have symptoms or because of my age? If the answer is age alone, have a conversation about whether it's truly necessary. Test number 4, colonoscopy after 75. The fourth test, and this may be the most surprising one, is a colonoscopy after age 75. Now, before anyone clicks away, I am not saying colonoscopies are bad. For people between roughly 45 and 75, regular colonoscopy screening is one of the most effective cancer prevention tools we have. It has saved countless lives. I fully support it within the recommended age range. But after 75, something changes, and most people are never told about it. Here's what the data actually shows. The United States Preventive Services Task Force, the gold standard body for screening recommendations, states that routine colonoscopy screening after age 75 should be an individual decision. And after age 85, they recommend against it entirely. Multiple countries have similar guidelines. Why? Several reasons, all grounded in data. First, the risk-benefit balance shifts. Colon cancer typically grows slowly, very slowly. A small polyp found in a 50-year-old has decades to potentially develop into cancer, but a small polyp found in an 80-year-old is statistically unlikely to develop into a life-threatening cancer within that person's remaining lifetime. The polyp may never become a problem. Second, the risks of the procedure itself increase significantly with age. A colonoscopy requires bowel preparation, the prep that involves drinking large volumes of fluid and completely emptying your bowels. For an 80-year-old, this prep can cause dangerous dehydration, electrolyte imbalances, and in some cases, kidney injury. For people with heart conditions, the fluid shifts can trigger cardiac events. Then there's the procedure itself. The sedation used during colonoscopy carries increased risk in older adults, slower recovery, confusion, respiratory depression, and falls after the procedure. Older, thinner bowel walls are more susceptible to perforation, a tear in the colon that can be life-threatening and require emergency surgery. Third, the cascade effect applies here powerfully. If a polyp is found, it will be removed. If it looks even slightly unusual, it will be biopsied. If the biopsy shows any precancerous cells, even very early, slow-growing ones, it may trigger recommendations for surgery, repeat colonoscopies at shorter intervals, or even chemotherapy discussions. Each step carries compounding risks for an aging body, and the data suggests that for many people over 75, particularly those who have had regular screenings throughout their life with clean or low-risk results, the cumulative risk of continued screening begins to exceed the risk of the cancer it's looking for. This is not my opinion. This is published, peer-reviewed evidence from the very organizations that design screening guidelines. If you're over 75 and your doctor recommends a colonoscopy, ask these questions. What were my previous colonoscopy results? If they were clean or showed only low-risk polyps, is continued screening still justified? What are the specific risks of this procedure given my age and current health conditions? And what is the realistic likelihood that this screening will change my health outcome? You deserve honest answers to those questions before you agree. What you should do instead. Now, I don't want you walking away from this video thinking that all medical testing is dangerous or that you should stop seeing your doctor. That is absolutely not the message. The message is this: be a thoughtful, informed participant in your own healthcare, not a passive recipient. Here's what I recommend instead of blanket screening. 1. Prioritize symptom-based testing. If something changes, if something hurts, if something feels wrong, investigate it aggressively. Diagnostic testing based on real symptoms is one of the greatest achievements of modern medicine. Never ignore genuine warning signs. 2. Have an honest conversation with your doctor about risk versus benefit. Before any test, ask, what are you looking for? What happens if you find something? What are the risks of the test itself? And what would happen if we simply monitored this instead? A good doctor will welcome these questions. 3. Consider your overall health picture. A healthy, active 78-year-old and a frail 78-year-old with multiple conditions are not the same patient. Screening decisions should be individualized, not applied by age alone. 4. Protect your mental health. The anxiety generated by uncertain test results is a genuine health risk for seniors. Chronic worry elevates cortisol, disrupts sleep, weakens immunity, and accelerates cognitive decline. Avoiding unnecessary testing is, in part, about protecting your peace of mind, which is itself a health outcome. 5. Track your own body. Nobody knows your body better than you. Keep a simple journal of how you feel, any changes you notice, any new symptoms. This gives your doctor far more useful information than a random scan of an asymptomatic body. Why doctors order these tests? Now, I want to say something important in defense of doctors, because I think it's unfair to make them the villains of this story. Most doctors who order these tests are not being careless. They're not trying to make money from unnecessary procedures. Most of them genuinely believe they're being thorough and protective. The problem is systemic, not personal. Doctors are trained in a culture of do everything. They face enormous legal pressure. If they don't order a test and something is later found, they can be sued for negligence. So the safer career move is always to order the test, even when the evidence says it's unlikely to help. There's also the emotional pressure from patients. Many seniors, understandably, feel reassured by testing. They want the scan. They want the all clear. They feel that refusing a test is being reckless. And doctors don't want to seem dismissive of a patient's concerns by saying, "I don't think you need that." So the cascade continues, driven not by bad medicine, but by a system that incentivizes testing over restraint, and by a cultural belief that more information is always better. But more information is not always better. Sometimes more information is just more noise, and in an aging body, that noise can trigger a chain of events that causes real measurable harm. The best doctors, the ones truly practicing evidence-based medicine, are the ones who have the courage to say, "I don't think this test will help you, and here's why." Seek out those doctors. Trust those doctors. They're the ones who are truly looking out for you. Here's what I want you to carry with you after today. Your health after 65 is precious. Every decision matters. Every test, every procedure, every intervention carries weight, both physical and emotional. And you deserve to make those decisions with full information, not just compliance. Saying no to a test, or even not yet, or let me think about it, is not being difficult. It's not being irresponsible. It is being an active, educated guardian of your own health. And that is one of the most powerful things you can do for yourself at any age. Nobody cares more about your health than you do. Not your doctor, not the hospital, not the insurance company, you. So give yourself permission to ask questions. Give yourself permission to want evidence. Give yourself permission to say, "Help me understand why this test is right for me specifically, not just for someone my age." If this video opened your eyes to something you hadn't considered before, please hit the like button. It genuinely helps this information reach other seniors who need to hear it. And there are millions who do. Share it with your husband, your wife, your friends, your siblings. Forward it to anyone over 65 who might be facing a medical decision right now. And if you haven't subscribed to this channel yet, please do. Every week, we break down the health topics that truly matter after 60, in plain language, with real evidence, and always with your best interests at heart. Thank you for your time today. Thank you for being the kind of person who doesn't just accept, who asks why. That instinct will serve your health better than any scan ever could. Stay well, stay informed, and I'll see you in the next one.